Hey everyone, welcome back to Health Matters, the podcast where we break down the latest medical research so you can stay informed and empowered.
Today we're tackling a topic that's sparking debate in both medical circles and on social media, cannabis use, and its link to type 2 diabetes.
A massive study, over 4 million adults, has just come out of the European Association for the Study of Diabetes conference in Vienna, and it says something you might not expect.
According to Dr. Ibrahim Kamel from Boston Medical Center, cannabis users had nearly a 4-fold higher risk of developing type 2 diabetes compared with non-users.
The researchers pulled electronic health records from 54 healthcare organizations across the US and Europe, covering patients aged 18 to 50 between 2010 and 2018.
They identified almost 97,000 people who had cannabis-related diagnoses, anything from occasional use to dependence, and matched them with more than 4 million healthy controls.
After 5 years of follow-up and adjusting for cholesterol levels, blood pressure, heart disease, cocaine, and alcohol use, plus other lifestyle factors, the findings were striking.
New diabetes cases rose to 2.2% in the cannabis group versus just 0.6%. Among the controls, almost 4 times higher risk overall.
Dr. Kamel cautions that this is a retrospective study, so we can't say cannabis causes diabetes, but the association is hard to ignore.
He points to possible mechanisms, insulin resistance, and poor dietary habits often seen in people who use cannabis regularly.
The study also highlights gaps, like limited data on how much or what type of cannabis was used, and acknowledges that residual confounding could still be at play.
Still, the implications are clear for clinicians. When treating substance use disorders, it's wise to discuss diabetes risk and consider routine metabolic monitoring.
And for patients, whether you're using medical or recreational cannabis, being aware of your blood sugar levels and maintaining a balanced diet could make a real difference.
The researchers are calling for more research on long-term endocrine effects, especially comparing inhaled products to edibles and other forms.
So what does this mean for you? If you're a cannabis user, consider getting your glucose checked periodically and talk openly with your healthcare provider about any concerns.
And if you're not using cannabis but are concerned about diabetes risk, remember that lifestyle factors, exercise, diet, sleep are powerful tools in preventing the disease.
That's all for today's episode of Health Matters. Thanks for listening, and stay curious, stay healthy.
See you next time, that's Children.